Welcome to the introduction of the detailed exploration of why governments used excessive power during the COVID-19 pandemic. In this presentation, we will journey through the entangled world of state and power, as well as consequences on social welfare and civil liberties. Let's now listen to Prime Minister Trudeau's March 17, 2020 address to the nation.
I want to recognize that earlier today, the province of Ontario announced a provincial state of emergency. At the federal level, we've been coordinating with them and continue to do so. Ontario is taking the right steps to protect people and the healthcare system. And today's announcement is an example of what we're seeing across the country.
The nation-state is responsible for enforcement of law monopolizing violence legitimately, economic infrastructure, and property ownership rights. As noted in our lecture, decades now, wealth and power has been shifting from states to markets. It emphasized the diminishing role of nation-state in light of global forces influenced by multinational corporations, non-government organizations, and transnational migrant movement trends. However, the pandemic presented governments with a crucial opportunity similar to wartime to enhance state power and halt, possibly even reverse its declining influence in a globalized world. These actions included implementing nationwide public health protocols, vaccine acquisition and distribution, stability of vital supplies like food, and economic support for citizens and businesses. The rapid global spread of COVID-19 pandemic unveiled the economic fragility of supply chains. The shortage of critical medical supplies and equipment such as ventilators, masks, and gloves led to extremely overwhelmed hospitals. Similarly, grocery stores experience extraordinary shortages of food and basic necessities such as toilet paper on their once fully stocked shelves. Furthermore, COVID-19 brought to light the deficiencies in social welfare and healthcare, just to name a few, which were unprepared for the pandemic. Why did the government use excessive power during COVID-19? How was it enforced? Who benefited, and were there inequities? Did this power increase nationalism? Let's see how the theories from Charles Tilley and Benedict Anderson help us to better answer these questions. Since the 18th century, in addition to wars, nation-state growth was partly due to the state's ability to curtail infectious diseases using healthcare mandates. Government reactions to COVID-19 displayed parallels to strategies used in warfare, mirroring Charles Tilley's theories on state formation and consolidation. These included resource mobilization, power centralization, and the art of rhetoric to combat the global health emergency. Governments redirected industrial capabilities of resources and manufacturing to produce medical supplies such as masks and sanitizer, a wartime reaction in the face of a pandemic. In March 2020, Prime Minister Justin Trudeau provided $1 billion to support the healthcare system, public health preparedness, and $10 billion to help workers and businesses. Similarly, Ontario funded $304 million to improve their pandemic response. The Canadian federal government halted border entry of non-citizens and required the arriving travelers to self-isolate for 14 days. Simultaneously, Ontario imposed the closure of all indoor recreational programs, libraries, schools, restaurants without takeout, and theaters. All public events of over 50 people were prohibited, including places of worship. As in wartime, Prime Minister Trudeau offered hope and support with messages such as, "We will get through this together," "We can make choices that save lives," and "We choose to support Canadians." Frequent communication reinforced government actions leading to increased nationalism. It is interesting to note that Tilley's statements of war risking and state-making is our largest examples of organized crime, and banditry, piracy, gangland rivalry, policing, and war, making all belong on the same continuum, reflected Columbia's crime gangs enforcing pandemic rules as directed by their municipal government. Seeing all of these emergency actions to protect the nation in a centralized manner aligns with Tilley's views on state power during wartime, leading to state consolidation. Benedict Anderson explored the critical role of books and newspapers in envisioning imagined communities, a concept central to the idea of nationalism. Consistent exposure to such materials allows people to envision themselves as members of a broader community, connected to other individuals they have never even met. This feeling of connection is rooted in shared factors such as language, ideologies, personal attributes, and other facets of national identity. Anderson noted, "No more arresting emblems of the modern culture of nationalism exist than cenotaphs and tombs of unknown soldiers. This highlights the unknown soldiers' tomb's significance in imagined communities, where it induces patriotism and national unity." What images do you consider symbols of Canadian nationalism? How are these different from those of the United States of America? The mandated isolation increased the usage of television and social media related to COVID-19 spread and deaths, enlarging our sense of community. The images of overcrowded hospitals, funerals attended by few socially distanced family members unable to embrace each other are connections to individuals that we have never met. The media portrayal of these community events creates an emotional bond within the imagined community, fostering nationalism. The political leaders use their influence to exploit television and social media to share their experiences, such as wearing masks, bumping elbows, and being vaccinated to further elevate a sense of shared community and belonging. These visuals help to expand imagined communities used to shape our national identity and increase nationalism. Did the government power increase nationalism? Durkheim stressed that institutions are not static and are always weakening, strengthening, or evolving. China's lockdown of Wuhan within 3 weeks of the first COVID-19 case prompted governments to quickly form their own pandemic task groups that recommended nationalistic mandates to curb viral spread. The shortcomings of broken supply chains, coupled with the private sector's inability to restore public confidence, highlighted the necessity for swift, unprecedented government power during the pandemic. Collective mandates and distribution of resources reinvigorated institutions and communities, fueling nationalism. Nationalism also increased from hearing inspiring state leaders' speeches and seeing altruistic essential workers and volunteers risking their lives to help the community. What other extreme powers did the government use? Russia's President Putin reduced the power of the courts and parliament and removed the presidential term limits. Cambodia's government used their extended powers to apprehend and confine those that criticized them or spread misinformation. New York police were seen assaulting those that violated social distancing. In China, strictly enforced policies included population temperature screening in public areas and 14-day quarantine for anyone infected or exposed to the virus. Did the lockdowns help reduce COVID-19 related deaths? The Canadian government actions of lockdowns and other public health measures successfully helped flatten the curve of COVID-19 deaths, as shown in this figure. Did corporate bailouts help? They sure did help turn around the equity markets from a rock bottom in March 2020 to a rapid growth immediately after the United States government announced their corporate bailouts. It is not surprising that the top stock market value increases were Amazon, Microsoft, Apple, Facebook, and Alphabet Google, increasing by 401, 270, 219, 86, and $68 billion respectively. Vaccine makers of Moderna and AstraZeneca increased by $20 and $8.7 billion. How did these bailouts help the billionaires? The 10 wealthiest men each increased their wealth by at least $100 billion. Elon Musk led the group with $294 billion. Who supported these corporate bailouts? The 97 United States Congress members participated in pandemic-related committees. Coincidentally, these members or their family made investments in the same companies for which policy decisions were made. Did they have the best interest of the working class in mind when approving corporate bailouts? What have we learned? From a Marx view on social conflict, the government influenced by the dominant class, including lockdowns and corporate bailouts, could justify that the government was not motivated for altruistic reasons. Instead, it may have been to hasten workers' return to their jobs and optimize financial gains for the dominant class to uphold the class hierarchy. According to Tilley's viewpoint, people pay taxes to get protection against enemies, highlighting the state's motivation to use its power during the pandemic to keep people alive to pay taxes that sustain the state. Looking through the lens of Anderson's imagined communities, the government usage of unprecedented power during the pandemic has resulted in an expanded sense of shared community across the country that reunited citizens with an increased nationalism. The government's success in revitalizing their institutions demonstrated the state's return. In conclusion, facing an unprecedented global health crisis, governments, including Canada, had to implement extreme measures comparable to wartime efforts to stop COVID-19. Dealing with a novel virus without known treatments, every state reinforced strict lockdowns, quarantines, and mobilization of resources to reduce viral spread and societal impact. If not for the government, who could we have trusted to implement public health campaigns and accelerate vaccine distribution? However, government excessive powers, including lockdowns, raises important questions about the balance of power and the role of state authority. While justified under the circumstances for the collective good, we must carefully safeguard our civil liberties. The pandemic calls for a reevaluation of local and global pandemic planning and of government budgets to increase public health and social welfare. Despite Canada having universal health care, infections and deaths were found to be the largest in marginalized groups, including migrant workers, ethnic minorities, and those living in overpopulated accommodations. Moreover, Indigenous communities were not all able to access drinkable water on reserves. Before the pandemic, over 100 reports predicted a nursing home crisis, and it is not surprising that Canada was identified as having the most deaths in this vulnerable group. Lastly, Canada's vaccine nationalism during the first 2 years of the pandemic missed an opportunity on the world stage to share their 418 million vaccines with impoverished countries. The pandemic also highlighted that the community volunteers, teachers, grocery clerks, drivers, and sanitation workers emerged as indispensable to uphold crucial institutions. Therefore, we must not let the dominant class to keep its grip on government policy that prioritizes benefits for corporations and unfair wages for essential workers. Let's join in solidarity to advocate for policy changes and social welfare reforms.